Hey guys, it's Dr. Scott. I'm here to talk to you about the HCG Reconstitution, and you'll go over this with our staff before you leave, but hopefully this is just going to serve as a reminder of what we've gone over. You'll get a pack like this, and it actually says directions for reconstitution right there, but we're just going to go over it. It takes 2 minutes, so let's look at it together, okay? First thing you want to do is you want to wash your hands. You want to get a clean area for yourself to use. Let's just see what's in here. Ooh, fun. So, the first thing you have is an HCG bottle, and you'll notice that it's a powder, and so that's why we're going to reconstitute it with bacteriostatic water. So it'll liquefy it. So then we have a couple of alcohol pads, and we've got a 5 cc syringe, and we have a needle. So we've washed our hands, we've got a clean area to work with, and now we're going to get ready to start. So the first thing, and by the way, we always talk about keeping the HCG in the refrigerator. You don't need to do that until after you reconstitute it. So once it's reconstituted, then you'll do that. So you want to take off the caps. Jeez, okay. It's not really that hard. And take an alcohol swab, and you're going to see that there's a little rubber stopper in the middle there. So you're just going to wipe that off. Okay. And then the next thing you want to do is you want to get your little syringe here. It's a 5 cc syringe, and your needle. What I do is, it just makes it easier this way. I will open up the end and peel it back like that. So it leaves kind of the tip open there, if you can see it. And then what I'll do is hold back it like that, and I'll just put it in and just screw it on. Make sure it's tight. The next thing you want to do is we're going to do a 5 cc draw out of here. So if you were to just to put your needle in and draw it up, it would be kind of a hard suction. So you want to equalize the pressure. So because we're going to draw 5 cc's out, we're going to put 5 cc's of air in. So we'll draw it up to the 5 cc line. Can you see that? Okay. And then what you'll do is just go right in the center of it, the bacteriostatic water, and then you're just going to push the air in. And when you turn it upside down, you'll see it wants to come out on its own without even having to do anything, but you can help it along. So you'll pull it back to 5, and one of the things people say is, well, I'll tell you what I do actually. I go a little bit beyond 5 because you'll always get a little bit of air, like an air bubble. So you'll just kind of pop it a little bit, and you'll see air go to the top, and then you'll push it and right to the 5 mark, okay? Once you do that, you've already cleaned this off. You're just going to put that in the center there, and you'll see that it goes, it'll start drawing it in, and you can see right there. You just gently going to push through it, and then once it's in, there's absolutely no need to shake it. So you'll notice I didn't. I'll put this. Actually, I'm going to tell you what you do. You don't set that there. What you do is you have a container that you're going to use for your sharps, and we're going to tell you how to do that. And you'll pop that into your container. Okay, so we'll just set that there. You don't want to shake this. What you'll do is you'll just kind of stir it like that gently. All right. And I'm going to show you because I have one here. This is what your injection syringe will look like. It's a 50 unit or a half cc. A 50 unit insulin syringe is what it is. So this is just the cap for the protected tip there. And again, so every morning, this will be in your refrigerator. So every morning you'll take it out, and you'll wipe the stopper off, and you'll take this off, and I will pull it back to 1.5. Why? Because 1.5 equals 150 units, and that's generally what we start with here. But if it's, if it's 130, then you go to 3 lines past 10. Okay, so you just do that again for the same premise of what I mentioned before. You just put it in the middle there, and again, be careful because these needles, they're just like a hair. They're tiny. They're called 31 gauge needles. They're very small, and they bend very easily. So you'll just push the air through, and then what you'll do is you'll pull it back to the 1.5 mark, okay, and take it out. And then you'll get another alcohol swab and you'll inject like we've taught you to, okay? So if you have any questions after doing this, and I'm just putting those back, if you have any questions, please let us know. It's very easy to do, but you do want to do it correctly. Don't forget to dispose of these in the proper receptacle that we'll talk about separately. If you have any questions, call us at 704-282-9355. Thanks a lot for joining me.